The first 24 hours after surgery are not about recovery. They are about survival, stability, and information. This is the window where the body reacts to surgical stress, where anesthesia wears off, and where early warning signs, if they appear, begin to show themselves. From a surgeon's perspective, this period is not about perfection, it's about patterns. This content is for general educational purposes only and does not replace medical advice. Postoperative care varies between patients and procedures. Always follow the instructions given by your own surgical team. Surgery doesn't end when the incision is closed. What happens afterwards tells us whether the body is adapting or struggling. During the first 24 hours, surgeons ask a few fundamental questions. Is the patient stable? Is the response expected? Are there any early signs that something is going wrong? We are not hunting for rare complications. We are watching for change. In the first 24 hours after surgery, vital signs are often the earliest objective indicators that something may be wrong. They are the harbinger. Before lab results change, before wounds look abnormal, and sometimes before the patient can clearly explain what feels off. Vital signs begin to shift. We monitor heart rate, blood pressure, respiratory rate, and temperature. Not because we expect complications, but because physiological stress announces itself quietly. What matters most is not a single number, but it is the trend. Pain after surgery is expected. Some pain tells us the body is responding normally, but pain is also information. We don't just look at how much pain there is. We rather look at how it behaves. Is it stable? Is it localized? Does it respond to treatment? Pain that worsens rapidly or spreads unexpectedly, fails to respond to appropriate medication, raises concern. And this matters. Postoperative pain is never ignored or intentionally minimized. Pain is treated not only for comfort, but because uncontrolled pain slows recovery and clouds clinical judgment. Good care is not about enduring pain, it's about listening to it. Some bleeding after surgery is expected. What matters is how much and whether it's changing. We look at drain output, dressings, swelling, and vital signs altogether. Fluids and blood products are given only when clinically necessary. Too little fluid can strain circulation and kidneys. However, too much can stress the heart and lungs. Blood transfusions are not routine. In cases of limited bleeding, transfusion itself can increase complication, meaning it can cause further bleeding. The goal is simple. Exactly what the patient needs. No more, no less. The brain is one of the most sensitive organs after surgery. Some grogginess is normal. Change, however, is not. Increasing confusion, agitation, excessive drowsiness, or difficulty walking are never ignored. The brain often reacts before other systems do. When mental status shifts unexpectedly, it tells us the body is under strain, and that further assessment is required. Breathing problems are common and often silent. Pain, anesthesia, and immobility all reduce how deeply patients breathe. Persistent shallow breathing can lead to atelectasis, a partial collapse of small air sacs in the lungs. This reduces the oxygen exchange and increases the risk of pneumonia. That is why oxygen levels are monitored continuously, even when everything looks calm. Wounds and drains tell a story. Some redness and drainage are expected. What does concern us is rapid change. More swelling, increasing pain, rising output, or new characteristics in drainage. Drains aren't routine. When used, they prevent accumulation and give us information before problems declare themselves elsewhere. After abdominal surgery, it is very common for the gut to be quiet in the first 24 hours. That alone is not a catastrophe. What matters is progression. Urine output reflects circulation and kidney perfusion. Catheters are not routinely used just for monitoring, but they may be necessary, especially after an epidural or spinal anesthesia. These systems don't fail silently. When they slow down, the body is asking for support. The first 24 hours after surgery are a checkpoint, not a finish line. Passing this checkpoint with stable trends tells us the body has tolerated the operation and anesthesia. It does not mean the risk is over. Many complications develop days later, but early stability gives us a platform to continue recovery from. Surgery is not one moment, it's a process. And the first 24 hours is simply the first test.